Okay.
Great. What else have we got?
So the next procedure you may be doing is phlebotomy, and there are two variations for phlebotomy. One thing that I would like to point out is that could be a risk, because this vacutainer is intended to go with this butterfly with collection set, and these pieces of equipment are to go together. But there is the quick shield, absolutely. But there is a risk that you could marry these two bits together.
I've seen that.
And that there's absolutely nothing, no safety aspect of this. When you pull that apart, your rubber sleeve covers the needle there. So
is there a needle under there?
There is absolutely a needle. I'll show you carefully. And
it's
quite thick.
Okay.
It's quite
and
thick.
We've had reported needle stick injuries from this back end.
Yes.
Yep.
So that needs to, the back end. The back end of these are the same in both devices, and they absolutely need to be covered by a vacutainer. If you attach your blood bottle without that, that's potentially where staff are being injured. So, so if I demonstrate, so that also is a big needle. There is no way to make that safe. Absolutely. So those two bits of equipment you should take care.
And I can see, Nikki, how if I'm taking blood from you with this, okay, and at this moment in time you decide to go 2 shades paler, and I start to worry about that, then I'm not thinking skin to sharp spin anymore.
No, you're just thinking.
I've kind of lost that as I'm thinking what's happened to Nikki, and this goes on the floor, the bedding, the black bag. That this is absolutely not the right thing to do.
No, you're right. You're right. So I'll show you the way the two pieces of equipment. So great care needs to be taken to make sure you're using the correct pieces of equipment together. So again, everything's covered when it's in the packet so that it doesn't stick out, and to keep it sterile. So you have your needle under this sheath here, and that goes into your vacutainer and twisted round. And then you remove the sheath from this other end of your butterfly and bend your wings back, and then carry out your phlebotomy. So the way to activate the safety in this is there's plastic clips. I don't know if you can see them there. So you would apply your pressure to the entry site, secure the wing with a finger so that it doesn't fly out and give yourself a needle stick injury. And then you press the two clips at the side and withdraw that back, and you'll hear a click.
I heard that click.
So then you know that doesn't come out. And there's sometimes a temptation for staff to withdraw the needle from the vein and then activate that, but there is a risk there that could slip from your finger and and jag you. And some people often say, well, you know what, everything's going into the sharp spin, what's the need to cover? But things like these, so we use these in my clinical area because veins are pretty fragile, but actually when you're finished with it, this long tube becomes a bit of it can become a bit of a risk. So when you put that in the sharp spin, even though that's in the correct place, it could be sticking up the way, and then the next person that puts something in the sharp spin gets a needle stick injury. So that's why we say all sharps, even if you're 100% sure it's going in the right place, it should be activated to reduce that. So
am I right in saying that the only time that you should see that needle is when it's clean? Because we shouldn't see it once it's out of the patient. Once we're finished with that phlebotomy, we shouldn't be able to see it because it's retracted.
Absolutely. So if you inspected your sharp spin, you shouldn't be seeing any needles, just all covered. So then this is then another version of a phlebotomy set, which is probably more commonly used in clinical areas. So again, pull off the grey sleeve and then twist that in to the vacutainer. So this is the safety aspect of this device. So then do your phlebotomy. Okay, apply your pressure to the vein, and on your nearest solid surface, click it in.
That's a definitive click, isn't it?
Absolutely, and that's quite clear to hear. Obviously, you're not risking blood spill everywhere. Do it as close as you can. and then straight into the sharps bin. Okay.
And then even in any kind of circumstance that's not nice and controlled and calm, if that was to go into the bedding or anything, we're safe in the knowledge that it is a concealed needle, and it's, unless you really fight with it, it's not going to come out.